You're trying to get pregnant and you just found out that your cycle is irregular, meaning you have irregular periods. You see your period this month and it's not there again. It doesn't come until, say, 2 months, sometimes 45 days, 60 days, or even more. And now you're worried, thinking, can I get pregnant with this kind of cycle? Have women gone ahead to get pregnant with irregular cycles? Oh yes, a lot of women have. In fact, the fact that you see your period every month doesn't guarantee that you're ovulating. Now, if your cycle is irregular, one way to look at it is you may not be ovulating, but it's been found in many women that even with irregular cycles, they still ovulate, but they ovulate at different times in different months. Like for each cycle, they ovulate at different times, which makes it difficult to predict ovulation, especially if you're using the rhythm or the calendar method, or even some cycle tracking apps that do not ask for any other information apart from your last period. It would be difficult to predict right, using those sort of methods, because it's happening at different times, and those methods use a particular formula or an algorithm to calculate or predict your next ovulation or your fertile window based on previous periods. So it's not the best option. Is there a way you can get pregnant faster? Of course, that would be using the symptothermal method of fertility awareness, and that's what I'll be teaching you to. How to get pregnant with irregular cycles. 4 ways chatting can help you. So just so we're on the same page, what counts as an irregular cycle? So many times I've had women come in, over the phone where I'm having consultations, and she's like, I have irregular cycles, I have irregular cycles. And then when we go back to looking at dates of previous periods and calculating the different phases of the cycle, yes, you find out that the period isn't exactly regular, but it's not irregular. So irregular cycles or periods would be having menstrual cycle lengths for different months that vary with about 7 days or more. So for example, if you have a 30-day cycle length, that would be seeing your period, you're expected to see your period every 30 days, and then all of a sudden from 30 days it's going to 39, it's going to 40, and maybe going back to 29 days, that sort of thing. 7 days or more would be seen as irregular periods. But if you have a 30-day cycle length and your period decides to come on 28 day, 29 day, or even 31st day, that's not an irregular period. It's not exactly regular, fine. Many women have it that way, really. Just a few women have their periods coming at a particular date every month. So how can chatting help you? Right now we understand what irregular cycles are. It's possible that you also have regular cycles and have tried to time sex, when you should be ovulating in your fertile window, and you still haven't had success using the reading method or the calendar method or some certain cycle tracking apps. This video would help you as well. Now, the first way chatting can help you would be knowing exactly what is going on with ovulation for you. Are you ovulating? So from the start of the video, I talked about having regular cycles and not ovulating. So the fact that you have periods month after month doesn't exactly mean that you're ovulating. Can't guarantee you're ovulating all the time. Right now, if you have irregular cycles, chatting with the symptothermal method just tells you when exactly you ovulated. It can tell you when exactly you ovulated. It can also tell you when ovulation is approaching using your body's vital signs. Now, these vital signs are your temperature, your cervical mucus, your cervical position. Sometimes people like to add the use of OPKs, that's ovulation prediction kits. Now, this gives you a full picture of what is going on exactly with you. So ovulation can be delayed. Ovulation may not happen. Yes, ovulation may be happening, but your timing wrong. This is how the symptothermal method of fertility awareness helps you. So I won't be going in depth to how to chat in this video. I have free trainings, I have resources. I'll just link them somewhere below this video. You go over them and listen to them. So this is not a chatting video. This is just showing you the benefits of chatting. Now, this is how chatting would help you know exactly what is going on with ovulation for you. So it answers the question, am I ovulating? When am I ovulating? So I'll be showing you some examples using cycle charts of some women. So this is a normal ovulatory cycle, a cycle which ovulation happened. So you can see from day 1 to day 4 of her cycle, these are days here, she had a period. There was no cervical mucus afterwards for about 3 days, and then she began to notice sticky, which became wetter and turned into creamy. After then, she's having egg white, cervical fluid in different quantities, with the highest happening on day 13, right here. So how did she know that she ovulated on day 13? Apart from this, which is the cervical mucus, you have temperature readings here as well. So you see this chart shows two distinct temperature ranges. So you have pre-ovulation low temperatures and post-ovulation high temperatures. I talked about the reason why your temperature would go up in my video because of the progesterone hormone, which causes heat in the body. Now you can see that temperature goes up and is sustained. It stays high up until it's coming down again on day 26 of the cycle and her period is starting. So for when the temperature comes down, you'd be sure that your period is coming, that day. And talking about her fertile window, we can see in this particular cycle, she didn't really maximize, her fertile window. She had sex on the day where it was sticky, and 3 days after, right? So you can see that her temperature is coming down and the period is starting again. So she did not conceive in this cycle. So this cycle shows delayed ovulation for the same lady. You remember she ovulated around day 13, somewhere here in her previous cycle, but here you're seeing she's ovulating on day 16. So she has the same progression of cervical fluid, which is mostly common and ideal, but this isn't how it is in all women. So I'll show you a different one, but let's just finish this, right? And you can see her last low temperature was the last day of egg white, which was day 16 of her menstrual cycle. And then her temperature goes up and is sustained, in the second half of the major second half of her cycle. Yeah, so she's ovulating on day 16 here. Now, there are different reasons why a period will be delayed. One, she could have been stressed, she could have been ill, just several reasons. But when you chart using your calendar or some cycle apps, they would probably be predicting ovulation 14 days before the next period, which isn't the case here, right? So your app or your calendar, your marking wouldn't know you were sick and then, or you were ill and your ovulation had to be delayed. But because she's chatting, she can see that, you see, she had longer dry days here after her period. And for this cycle, she's taking advantage of her fertile window, which is starting she started having sex somewhere around here, which is day 13. She gave it a day in between, and then she's having sex again on day 15. So when she notices egg white, she's keeping at it at least once every other day. So she's giving a space of about 1 day and all. But when she begins to notice egg white, she keeps at it until 2 days past ovulation, where she has two high temperatures that have been sustained. This would be at least 48 hours past ovulation, and then she's sure that ovulation has happened and she can then take a break. You can see her cervical fluid also goes dry. But what else do you notice in this chart? You can see that her temperature isn't coming down either. So in the last cycle, you had her temperature coming down at about 13 days past ovulation, but here it's 14 days past ovulation, and her temperature, yeah, is still very much high, which suggests a pregnancy. So when you're pregnant, your temperature would continue to be high, and then maybe after 18 days you can then take a pregnancy test. So this is another way where your chart shows you of a possible pregnancy. So the benefits are endless, right? The benefits are endless. So your app or your calendar wouldn't see these changes, or like I said earlier, know that ovulation is not happening, because they don't know you more than you. So your body would always give you signs. So next up, we have an anovulatory cycle, a cycle where ovulation did not happen. So you can see the temperatures here is quite different from the ones I had shown you earlier, where you have pre-ovulation temperature and post-ovulation. You can see the difference. Here it's not like that. You see, it just goes up, down, up, down, up, down until the period comes in again. Right? So here you can see her period was from day 1 to 3, and she had dry days, of course. And for where she began to notice sticky, she noticed sticky for about 2 days. There's nothing after, and she's noticing fertile quality egg whites, on 3 different days during the cycle. So why is this happening if she's not ovulating? Well, her body is attempting to ovulate, but it's not getting through with it. So that's why you see that at different times it looks like she's ovulating, she's seeing egg white, but ovulation is not happening because we can't see a distinct rise in temperature which is sustained. So it's up and down, up and down. Her body is attempting, but it's not happening, right? Which is very common in most women. And for this here, well, we can say it's a period, of course, because it's blood, but technically it's not a period. This is a breakthrough bleeding because ovulation did not happen in the cycle. So this is just a breakthrough bleeding she's experiencing and not periods. So what would happen, for a woman who wouldn't chat is she would see egg white a few days and think, oh, I'm ovulating, ovulation is here, and maybe take advantage of that time thinking it's a fertile window. But what happens is she sees that she doesn't see success, with pregnancy. So this again is the reason why you have to chat with at least more than one sign so you can have a clear picture of what exactly is going on. So it's not just enough for you to say, oh, I have egg white, ovulation is coming, and in the real sense, ovulation is not happening. Two is it can help you understand the quantity and the quality of your cervical mucus, what we usually call vaginal discharge. So from the time of your period to the beginning of the next cycle, because of the hormones transition you go through in each phase of the cycle, you see that from after your period to most times just after ovulation or the day of ovulation, you see that your cervical mucus goes through different progressions, different texture, right? So during your period, you might not see your cervical mucus, or you will not see your cervical mucus actually because you're bleeding. But from after your period, it becomes dry. Now, as you move on through the different phases, your follicular phase up until your ovulatory phase, you see that it goes through wetter types, with the most common being egg white, that many women like to talk about. Egg white, egg white, egg white. Now, egg white might not be your fertile quality cervical mucus, but if you do not chat, you may not find out what is fertile for you. So some women are worried, saying, I never see the cervical mucus, am I ovulating? Yes, you might have creamy lotion, creamy looking like lotion, that kind of discharge, and that may just be your fertile cervical mucus. Some people have watery. Now, for you to ascertain which of these quality of the mucus or the texture of the mucus which is fertile for you, you have to chat over a period of time. Now, there's something we call double check method, right? You're not just using your cervical mucus. I talked about the different vital signs you can use. So you have to use your temperature as well. You can use your cervical position, and you can use your cervical mucus in determining your fertility, right? So for example, if you chat alongside your cervical position during the time of ovulation, you see that your cervix is soft, it is high up, it is open, and it is wet. So when you begin to chat this alongside the cervical mucus, you can then double check knowing which is which for you using a chart. I'll also show you examples using a chart so you can understand what exactly I mean. So for some people, it may not be egg white for you. You just have to know what is your fertile quality cervical mucus. Now, cervical mucus nourishes and transports sperm. So the reason why they'll say, of course, ovulation happens in one day, but you're fertile for about 6 days, 5 days before ovulation and the day of ovulation. So that's 6 days. The reason why they say you're fertile for this long is because the sperm can stay and wait for as long as 5 days in a woman's body. So it will stay waiting for the egg to fertilize the egg. So you have to be sure you have good enough cervical fluid and fertile quality cervical fluid. So have women gone on to get pregnant without seeing any cervical mucus, or without seeing the egg white, or enough fertile quality cervical fluid? Of course, yes, women have gone on to get pregnant. Now, if they've gotten pregnant without, but if you're trying to conceive and you do not have, you've tried for a while without success, you do not have enough fertile quality cervical fluid, you may begin to want to look into that. Now, this particular fertility sign gets people confused the most. So many people are like, I've tried to chat or even understand this fluid many times, but it just doesn't work for me. Now, most times at the beginning with most of my clients, this is always the case, right? They say, I've tried, I just don't understand this thing. In fact, I don't even have enough cervical fluid. And I'm like, okay, no problem. We begin to chat, and then I explain to them the different, of course, their video lessons. They go through the different ideal cervical fluid texture and even some others, so that way, you know, they begin to understand, and in just a few weeks, right, they understand. And then, so the next is watery fetal cervical fluid. You know, I've been saying egg white, egg white, egg white. Many women see egg white as well, but not everyone sees this kind of cervical mucus. So for this lady, you can see she has 2 days of creamy or lotion like, what she likes to call lotion like cervical fluid, and another 2 days of having watery fetal cervical fluid. Now, because she's chatting with her temperature, she can see that ovulation is happening here somewhere around, okay, yeah, day 13 as well. For this lady, you know, she has a short cycle. Ovulation is happening here around the 13. She can say that because there's an increased rise in temperature. And if this happens while she chats this cycle, the next cycle, she then knows that watery is her fetal, you know, quality cervical fluid. So the third way it helps you is it helps you find out other menstrual cycle irregularities or problems. So yes, you might be ovulating, you find that you time sex correctly, maybe using this method or some other method. That's for those who have the regular cycle. It could be the reading or the calendar method, because you have a regular cycle and you find that you always time sex during your fertile window, yet you're not seeing success. There might be other problems. Now, when I say other problems, what could this be? For example, you're ovulating. You might be ovulating too early in your cycle. So ovulating too early in your cycle doesn't give the egg enough time to mature. So you want to look at that length, your follicular phase, to see if it's long enough to produce a very well, you know, matured egg for fertilization. If you're ovulating too early, that might not happen. Now, you also have something called the luteal phase deficiency or progesterone deficiency. So I talked about the luteal phase earlier in this video. The luteal phase starts from after your ovulation to the beginning of your next period. So if it is too short, so ideally it should be 10 days or more. In fact, for some women, 10 days is even borderline, but it shouldn't be less than 10 days. So if you've confirmed your ovulation using at least 2 of your fertility signs, maybe your temperature and your cervical mucus or your cervical position, to time, you know, accurately to confirm, your ovulation or when you ovulated. From then, you can then count your luteal phase length. So if it's less than 10 days, that could be a case of luteal phase deficiency or progesterone deficiency, and I'll explain to you how and why this is considered, you know, to be a problem. So from the beginning of your cycle, you have the menstrual phase, you have the follicular phase, which also starts from the beginning of the menstrual phase up until ovulation. You have ovulation, and then you have the luteal phase. So after ovulation, the progesterone hormone increases. Now it increases to be able to build and thicken the lining of the uterus. That's the lining of your womb. So a fertilized egg, right, if the egg was fertilized during ovulation, it can implant. So many times, if progesterone is not enough, you find out that this lining isn't thick enough to accommodate a fertilized egg. In other words, your luteal phase is too short and it doesn't give a fertilized egg enough time to implant. So yes, fertilization might have happened, right, for a pregnancy to occur, but even when it tries to implant, it doesn't give it enough time to implant. So less than 10 days is too short a luteal phase. Now, when you chart using this method of fertility awareness, you can, because you can correctly time pinpoint when ovulation happened, you can also confirm your luteal phase length, which is not the case in maybe cycle tracking apps or even using the calendar method, because that way you are predicting and you're not sure. But in your chart, this way you see when ovulation happened, and then you can now count how many days to the start of your next period to determine your luteal phase length. If it's too short, fine. Now you know what the problem is. Finding the solution will be easier. There are different kinds of progesterone support treatments available, oral, injectables, and all of that. You will be given that just to increase your progesterone level and lengthen your luteal phase a bit. So this is another chart showing the luteal phase defect I talked about, where you have a short luteal phase of less than 10 days. So in this chart, she's using her temperature as well. Now she can confirm that ovulation is happening, you know, around here, which is day 17. Even after that, it goes up, right? And it's sustained, though it's coming down at intervals. But you can count how many days to see that it is not an ideal luteal phase. So it's 1, 2, 3, 4, 5, 6, 7, 8, 9, and then her period is starting again around here. So 9 days is too short. This would not give a fertilized egg enough time to implant in the uterine lining. So this is another chart showing progesterone deficiency, pre-ovulatory temperatures and post-ovulatory temperatures. What can you notice? You can see that these temperatures are not high enough. You see them coming down and hovering around the cover line. This can show a progesterone deficiency, right? Because the temperatures are not high enough and they are not sustained. And then you see the period starting again. So if you're not charting using your temperature, you might not know that you have progesterone deficiency. And the fourth and last point is it helps you with testing, quick diagnosis, and treatment. So when you chart your cycle using this method with all of the benefits I've just listed to you, it gives you a clear picture. That way you can give this information to your doctor to make the process faster. Because the truth is, many times they've given us diagnosis of unexplained infertility. Really, there's nothing like unexplained infertility. But when they've tried everything, they just tell you, well, this is a case of unexplained infertility, just go home and pray and just hope for the best, right? And this will be because they've confirmed you're ovulating, your hormones seem to be in check, and everything else, right? So they can't explain why you're not seeing success with conception. Now that's why they say the menstrual cycle is the 5th vital sign. Actually, it's like a medical report. It's like your medical report. So when you go and you chart your menstrual cycle from your chart, you can see a lot of things going on, and that way you can help with the diagnosis. For example, you can see hormonal problems from your chart, some hormonal problems from your chart. And then when you go to test, the problem we see very often, which is some of my clients have even, we've experienced this and I've had to counsel them, right? Sometimes you go and you want to get hormonal testings done. For the different phases of your cycle, there are different times where you should be checking particular hormones. Now, some of these diagnostic centers will not tell you that you're supposed to test a particular hormone at a particular period in your cycle to have accurate results. But sometimes we've gone to the diagnostic centers telling them you want to run a particular hormonal profile or a hormonal test, and they just say, okay, come, they draw your blood and all that. You will not get accurate results. Now, charting your cycle would help you know when exactly you should be going to get tested. So for progesterone, many times they'll say 7 days past ovulation. So if you can't pinpoint when ovulation happened, how then will you know when to go and get tested? So they'll just tell you, come in day 21 of your cycle, which is the case in many places, and day 21, quite alright, could be 7 days for a woman and past ovulation for a woman who has a 28-day cycle length. But for you who has a 30-day cycle length, that's not the case for you. So you should be able to predict correctly and pinpoint for you to now go back to the clinic and do the right testing so you can get more accurate results. So it will help your doctor as well. So you're not just going to the hospital and they're asking you questions, when did this happen, when did that happen? You're like, I don't know. So this gives you a lot more information. You have to be an advocate. You have to do these things yourself. You have to become in tune with your body. The first step to achieving success or finding the solution to any cycle irregularity or problem is knowing exactly what the issue is first. And the symptothermal method is the first step to achieving this goal. It's not difficult, like many people usually think. So like I've said, I have a lot of videos and free resources down here that you can go. I'll just link it somewhere below. You can go watch the videos, read the articles, and it would help you greatly. There are also resources for you to begin to chat. If you want to begin to chat, there are resources and video lessons you can purchase. There are group coaching programs where there are a lot of women as well going through the same journey, coming together to learn these things and to begin to practice them. And of course, we have our workshops coming up monthly, sometimes bi-monthly. Below the link to this video, everything you need is there basically. You can sign up for the upcoming workshops and many other things. So if you have any questions, comments, drop them in the comment section. I answer every question myself, and of course I would love to hear from you. what was your takeaway from this video? One thing that stood out for you throughout this video. Drop it in the comment section, and I'll be speaking with you pretty soon. See you again in my next video. Bye.